right, the thyroid gland. Let me ask you, I don't know, and I can't see hands, but it'd be interesting, and I suspect, here's what we'd find. If we had 10 people on the call, we'd probably find 3 or 4 of us that had issues with thyroid. The most common cause and problem of hypothyroidism is actually Hashimoto's thyroiditis. But let's back up for a second and talk about the thyroid gland. Let's talk about what you need to know and how it impacts your life. The thyroid gland is actually, it's located in your neck. If you take your Adam's apple, that little cartilaginous part right in the mid of your neck, the thyroid wraps around that. The gland only weighs several ounces. It's got 2 upper lobes and 2 lower lobes, kind of a butterfly-shaped organ there. But it's the master gland of metabolism. It's responsible for production of heat, maintaining blood volume, and muscular function. And guess what? Annually, you secrete less than a teaspoon per year of thyroid hormone. That's 5 cc's for you guys that are on the metric system. Isn't that amazing over the whole year? What are some of the signs and symptoms that your thyroid may not be working as well as it should? We call that hypothyroidism, like hypo, below, thyroidism. Okay. Well, you may have brittle nails, cold hands or feet, cold intolerance. You may be constipated. I like our patients to poop 2 or 3 times a day. You may be depressed, difficulty swallowing, dry skin, elevated cholesterol. It was amazing. It is amazing for me to see as I adjust thyroid hormones on folks that cholesterol, which is primarily just a sign of inflammation. It's like a warning light coming on in your car. It's not the end all and all this other stuff that's made out to be, in my opinion. But anyway, it goes down as we get the thyroid back where it needs to be. Even high blood pressure can be caused by hypothyroidism. Eyelid drooping or swelling, hair loss, you've heard of that one. Infertility, menstrual irregularities, muscle cramps, muscle weakness, weight gain, poor memory, and nervousness. Those are some of the signs that go along with this. Let's talk about how is the thyroid controlled. The thyroid, above the thyroid, you have the hypothalamus. That secretes thyroid-releasing hormone, which goes to the pituitary gland. The pituitary gland is kind of right between your eyes, about 2.5 inches back in there. On the anterior part of that gland, it secretes TSH, which stands for thyroid secreting hormone. And then that goes to the thyroid gland. And in the thyroid gland, you make 2 types of hormone. You make about 85-90% of what's called T4, thyroxine. And then you also make some T3, which is triiodothyronine, like 3 for tri. And that's really the workhorse hormone, then some T2 and T1 that may be involved in metabolic control and cardiac. But primarily you're making a T4 hormone. This T4 hormone has to go to other places in the body, in the cells, primarily in the liver, spleen, and many, many other areas all over the body. And the T4, you lose an iodine, and then it becomes T3. So T4 is kind of the pro hormone. T3 is the real workhorse hormone that carries out the thyroid function. Like we talked about, T2 is involved, and each time you're losing an iodine. So iodine is extremely important. We'll talk about that later. We feel like T2 is involved in the metabolic process and deals with weight gain or loss, depending on the level. And then T1, we're not real sure about that. Some think cardiac, some think heart. Just the heart function in that. As T4 is kind of the pro hormone, it's produced in one part of the body and then acts on another part. We've talked about that. And again, the T3, why is this important? So here's a pearl, okay? When you go to your doctor, let's get working. This is one of the things that if I were y'all, I'd write this down. When you go for your annual physical or whenever you go, get this checked at least once a year or twice a year. Get the TSH, just write TSH, write free T4, write free T3, write reverse T3, and then write TPO antibodies and thyroglobulin antibodies. You say, what in the world is this? Just save your daggum list. Doesn't matter if you understand a word I'm saying. Get your doctor to check those things. You go, why? If your TSH, most of the time in conventional medicine, we're trained to check only the TSH. If you only check a TSH, you'll miss 30 to 40% of people that are low that are actually hypothyroid. You know, and so if, you know, here's the deal. If a patient comes to me and they say, look, I'm not feeling well, and we start talking about, we go, well, why? And I'll invariably ask them, do you have dry skin, cold hands or feet, swelling? I ask them to stick their tongue out. You've seen some of these people, when you stick your tongue out, it's like, you go, how do you get that wide thing in your mouth? And from a medical point, Brian and I are thinking, man, that patient will be hard to intubate. But anyway, neither one of us are doing that anymore, but that's what I used to, and I still find myself doing that. But anyway, you go, okay, and then I'll go, how many times a day are you pooping? So you're getting an idea how their thyroid's functioning. But then we need to test it. So if you don't look under the stones, you're not going to find all the snakes. And so this is going to help get you checked properly to see where it is. Now, you go, all right, how do you figure out what's normal in these lab tests? And we'll come to that. All right, so far we talked about the thyroid gland as the main metabolic regulator of the body, and T3 hormone is the workhorse hormone that does most of the work for the thyroid. If you're starting with T4 and it's got to go to T3, you have to cleave off an iodine, and that requires certain minerals and vitamins. Like you need adequate amounts of chromium, iron, iodine, magnesium, potassium, zinc, vitamins B1, B6, B12, B9, and vitamin E. And you go, man, that's a lot of stuff. And it is. It is. And again, at the end, we'll talk about how I feel like that I'm able to get optimal nutrient support for my patients that have thyroid issues. Hormones that are involved in this are melatonin, testosterone, human growth hormone, insulin, and glucagon. So you see, there's a lot of players involved in helping the thyroid function like it should. We all know that stress and infections can adversely affect the whole body. Well, this is one of the reasons it really goes after the thyroid. It impairs the ability to convert T4 to T3, and you end up actually making more of a reverse T3, which is a mirror image hormone. T3, again, is the workhorse hormone, but this mirror image just sits on the receptors, and you do not get the work you should. When people have surgery, when they have trauma, their T3 drops. And again, so that impairs ability for things to go as it should periodically. So again, that's why it's so important to have the nutrient base and the hormone base before you have these adverse events happen to you. Heavy metal toxicity, good grief, we're all surrounded by all kinds of things in the environment that affect us adversely. So that's something, anytime I've ever checked anyone for that, we've all got heavy metals. I've never had a person that didn't have that. And then some of the genetic things, like MTHFR, that we talked about actually on another call, but where you're genetically, you're having a hard time processing some of the things that you should be able to get rid of, and you can't. So they end up accumulating in the body, which then feeds back to affect the thyroid. We talked about vitamin A a little bit. Let's talk about what it does. It helps bones grow. It's vital for vision. It also is important for lining the respiratory, the intestinal, and the urinary tracts. It enhances skin function and integrity. You can get that. Where can you get vitamin A? Liver. I know we're all eating that at least once a week. Eggs, milk. If you like liver, here's something that's interesting. Chicken liver has more iron per gram than does beef liver. Fruits like apricots, mango, and cantaloupe, and vegetables like spinach, green peas, and carrots. If you're supplementing looking for A, zeaxanthin, lutein, and lycopene are good choices. But you go, if you get too much, that's where you can get brittle hair loss, joint pain, and brittle nails, and actually yellowing of the skin. B2 riboflavin, what does that do? That helps convert food to energy. Helps regulate glutathione, which is the strongest antioxidant in the body. So that's a great thing. That's a great thing to have. You get it from meat and dairy products and green leafy vegetables. Hard to do well if you're not getting enough green leafy vegetables and some meat, which would encourage you to do organic meat. If you're a vegan or vegetarian, maybe you'll do some eggs or maybe you'll do some fish occasionally. Okay. B6, it helps metabolize proteins, helps your immune system. They actually in Indonesia and other places treat tuberculosis with high doses of B6. I just found that amazing. After I'd taken care of a guy that had died of tuberculosis, and I didn't realize it. I got a letter from the health department months later. That was an exciting day. My skin test for TB had already been converted. So anyway, we had an infectious disease guy, and we were talking, and I got online and started looking things up because I didn't want to get on like 4 to 6 medicines he was talking about. Here we go. All right, B9, folate, known as folic acid. Now, again, for those of us who have MTHFR and can't use folic acid as well, we need the methyl folate. But this is the vitamin they often give ladies when they're pregnant to prevent neural tube defects. It's very important for the formation of RNA and DNA, and it's involved in the interaction of B6 and B12. B12 enhances function of the immune cells. People's brains actually shrink as we get older because we don't have enough B12. It's involved in the arteries, nerves, and bones of the body. Again, you want to take a methylcobalamin or hydroxycobalamin. Stay away from the cyanocobalamin, which is probably the most common one that's used because it's less expensive. So check your labels. Everybody's heard of vitamin C, how it functions. It's mandatory for collagen, formation of blood vessels, skin, and it's critically important for stress hormones like epinephrine, norepinephrine, and cortisol. Probably ought to consider taking 1 to 4 grams a day of that. Vitamin E, what does that do? That functions to help protect the cell membranes. It helps control cell division and connective tissue formation as well. It helps protect us. It's anti-cancer and helps prevent heart disease, stroke, and neurodegeneration. It's found in meats, nuts, poultry, fish, beans, and eggs. So again, if you're a vegan or vegetarian, well, if you're vegan, you're not going to do that. But again, beans, but again, eggs and fish will help bridge the gap if you don't eat red meat. Iodine, oh my goodness, what if you could have one thing that is antifungal, antiparasitic, antibacterial, antiviral, and anti-cancer? That's iodine. And yet, probably over 90% of us are low in iodine. They used to put iodine in bread, and in the 80s, they took it out because they're concerned people were getting too much iodine, and they put bromine, which the people on the call here will recognize does nothing for your body health-wise. But they use it in soles of shoes, they use it in carpet and other places, but I don't know why they substituted that, but they did. Anyway, iodine, and since that time, the incidence of autoimmune disease and all kinds of diseases has skyrocketed. So you really, really need to be getting some iodine. Good sources of iodine are seaweed, kelp, saltwater fish, eggs, yogurt, and even cheese. It's in every cell of your body. So very amazing. It helps protect the thyroid. You've got to have iodine to make thyroid hormone. It helps with people that have ovarian cysts, uterine fibroids, fibrocystic disease of the breast. Again, those can all improve dramatically with iodine. Magnesium, it's the second most intracellular positively charged ion in the body. It functions in 300 different areas of the body. Critically important for the heart to function correctly. It interacts with calcium and phosphorus. It's also very important for nerve, enzyme, and energy metabolism, as well as vasodilation. You get about 80 milligrams of magnesium in one Brazil nut. So a couple of those a day will give you 80 times 2, 160 milligrams of magnesium, and 100 times 2, or 200 milligrams of selenium, which we hadn't gotten to yet. Other sources of magnesium are green leafy vegetables, spinach, nuts. Now, selenium. Again, we talked about the sources. Brazil nuts are great, meat, poultry, and mushrooms. This helps the T4 convert to the T3. It's also anti-cancerous, helps prevent cardiac disease, and helps prevent damage from free radicals. Zinc, one more other very critically important mineral, is involved in 200 different enzymatic reactions in the body, and it helps with RNA and DNA production, wound healing, cell metabolism, and lipid metabolism, and fertility. There are a lot of things, y'all, that mess up the thyroid. You go, why are so many people hypothyroid? Well, if we use Febreze, if we use a little tree thing that smells in our car, we're getting exposed to chemicals that will disrupt the function of the thyroid itself. You have to be careful if you're on birth control pills, beta blockers, dysrhythmic medications like amiodarone. Those can also really tank your thyroid. And you go, wow, what are you cleaning your house with? A lot of the things that ladies use or everybody uses to clean stuff, spray stuff, and all that, that really, really messes with us. Or maybe you're spraying Roundup around your house. Use something else. Use some of these organic things that'll kill the bad bugs and weeds and all that. And again, we talked about heavy metals. Arsenic, commonly sprayed on apples, found in well water. It's amazing. Lead, mercury. I don't know if you've got amalgam fillings, but if you've got the silver fillings, they're 40 to 60% mercury. Not good for the fish or us. So, what are you going to do about all this stuff? Let's talk about how can we help restore the thyroid. Well, you're going to need to get rid of these toxic elements. Cilantro, split cell chlorella. I'm trying to think of things you can buy over the counter. If you want another place to go look at, I put all my, basically all my patients end up on this for 3 to 6 months. If you go to resultsrna.com, they've got 3 products that I use there for our folks. And again, I'm the doctor. Some of the people on the call, I'm not other people, so I'm just giving you information. You decide if you want to use it. That's my medical legal disclaimer. Resultsrna.com. Our folks use the colloidal silver, the zeolite, which gets rid of the heavy metals, and they use glutathione spray. They take about 6 sprays twice a day. You can read on there and see about it, but that helps get rid of the heavy metals. That also helps get rid of I don't have anybody that doesn't have some type of virus. We all have some type of virus or tick-associated thing, which can basically put a wacko blow to your thyroid. I got bit by a tick over a year ago. Saw it, dug it out about 4 or 5 days later, didn't realize it was a deer tick. I got my practitioner to call in some doxycycline, was on it for 2 weeks. And then I got tested later. I still had rickettsia, and my thyroid was messed up more than it's been in the 8 or 9 years I've been checking it. So those ticks, I don't know what the Lord made them for originally, but I do not like them. Okay, so you need to replace these minerals and vitamins while you're detoxing and while you, just for optimization of your nutrients and minerals and vitamins. And you go, I gave you a list, and that was a good list of a lot of them, but there's still more. And you go, how are you going to get all that stuff in? I mean, you go, and look, I'm not a doctor, and I hadn't got, or I'm not a dietitian, and I'm not a whatever. Let's make it easy. There's a company that Brian can tell you about. It's called ID Life. You can get on his website, take an assessment, and that will help plug these nutritional and vitamin deficiency holes you have. And if you're hypothyroid or have hypothyroid symptoms, put one of your conditions as hypothyroid. That will give you nutritional things like selenium and all these other things we've talked about so that you can get up. That's the best way and the most inexpensive way I know to tell you to help fix this thing nutritionally and vitamin-wise. That's what I have my patients do. You can also use, well, I'm not even going to go. That's the easiest way, and that's going to be the most expensive, so let's just keep it practical. Retest yourself. Get your doc, whoever you're working with, to check you. Again, every 6 months, but certainly at least once a year, all those tests say, look, Look them up online. Don't say some doctor on some call told me. Don't. That's not going to help you, believe me. Do a little research, but that's how I was trained in the American Academy of Anti-Aging Functional Regenerative Medicine. Those are tests that they feel like give you the best look. It's 6 looks at the thyroid. It will let you see if you're low. It will let you see if you have Hashimoto's thyroiditis. So let's go there for a minute. What should you eat? Let me just tell you that eating this way, for a period of time, you go, man, that stuff I was eating before really, really tasted good. And it does. But it's really, really not good for you. More bad news. Congress and just took away in the Senate, they just voted in the past 2 days to take away, they overturned the Vermont rule where everybody's going to have to start labeling products for whether they had GMOs or not. And about 80% of all the products have GMOs in the stores. Unfortunately, the people have been overridden again, and Congress is going to decide what you need to know. And you're going to have an app to figure it out. So look, let me help you. Cut out bread, wheat, and pasta. Cut those things out. Barley, wheat, and rye, they've been genetically modified. The research is showing that they end up causing cancer, hypertension, diabetes, dementia. You don't want any of those things, and they also make you gain weight. The book is called Wheat Belly by Dr. Richard Davis, cardiologist. Excellent book if you want to look at it. Grain Brain by Perlmutter is another one if you want to look at that. So anyway, I haven't read that book, but I've read the Wheat Belly. So here's the deal. To protect yourself, if you'll cut these things out that you know that aren't healthy, that will also help improve your thyroid's health. The patients that I have that have resolved their Hashimoto's have gone gluten-free. They've cut out all this stuff we're talking about, their own thyroid medicine, and they're doing the ID Life. I've got at least 4 that way. I've got 2 patients that have resolved Hashimoto's just by changing their diet. But you're going to have to get, if you've got that, or if your thyroid's not functioning, that's the first place to start. So anyway, that's it. Just get retested, see how you're doing, and I hope this has been helpful. Again, write those tests down that we talked about and get your doc to test those. Are there any questions? We got a couple of minutes. Any questions?
Okay, everybody is unmuted. So if you have any questions for Dr. Roberts, be a great time to ask. Dr. Roberts, I'll ask a quick question. You mentioned several different vitamins that you recommend, and vitamins and minerals that you're recommending. And so if somebody, is there a place, like a website that you would recommend, or an amount, like a recommended amount? You know, because we have different folks from different parts of the country and different companies represented here. And
sure.
So is there a way that somebody could say, hey, how can I figure out how much vitamin A, how much vitamin B6, you know, all the different B vitamins, to help guide them through if they wanted to go and work on that in a different way?
Yeah, let me help you. Okay, write this website down. I just thought about this. www.sttm.com. That's sttm.com. That's Stop the Thyroid Madness by Janie Bowthorpe, who had Hashimoto's thyroiditis. That website is awesome. That woman has written the best book that I've ever read on thyroiditis or on Hashimoto's and thyroid education. Another great, and she's got stuff on her website where you can get the minerals and the amounts and stuff like that. If you want to piecemeal this thing together, you can go on there. That's a good reference point for you. Again, the easiest, least expensive, where you're getting where you know you're getting good quality stuff, is get Brian Timken's website. What's your site where they do the ID Life, Brian?
It's just briant.idlife.com.
Okay, so that way, if you take that assessment, then you can get the right nutrients. If you want to look at Janie's site, that's another good one. Another good book, if you've got Hashimoto's, is The Root Cause of Thyroiditis. I'm sorry, The Root Cause of Hashimoto's by Dr. Wentz, W-E-N-T-Z. She's a pharmacist who's had Hashimoto's and has done a beautiful job on that. And her website would be another good resource. Isabella Wentz, W-E-N-T-Z. The book is called The Root Cause of Hashimoto's Thyroiditis.
All right. Well, thank you very much, Dr. Roberts. I appreciate you being here. We do have about 1 more minute or so. Does anybody else have any questions?